we're good to go.
Okay.
So good morning,
Good morning.
Dr. Farnham. So to begin with, why don't you just kind of talk about, why and how you ended up in Medina? Some of your favorite memories of Medina, practicing in Medina, and then, just a little bit about your background.
Okay. Came here in Medina in 1963 with a wife and 2 kids. I was a graduate from the College of Medicine, Ohio State University, and I spent 5 years at Riverside Hospital in Columbus, Ohio. Altogether, I spent 9 years in Columbus, loved it dearly, enjoyed the football team and going to the sport games and all that sort. But there wasn't much chance of practicing medicine in Columbus as a newbie, as I would say. You had Mount Carmel Hospital putting out doctors, residents. You had Grant Hospital, Ohio State University, and of course, Riverside Methodist. So you got a wife, 2 kids, no money, and guess what? You have to go to work. We looked around at several places in Ohio, and most of those places, there'd been a senior doctor there, and he'd want you to start in as an employee. I did not want to be an employee. I wanted to be a part-time to a full-time partner, earning my way as we go. So interestingly enough, my father-in-law was a friend of Gene Austin here in town, and suggested I come look at Medina. Well, being a typical male, who's going to pay any attention to father-in-law or mother-in-law? I'm independent-minded on that. Well, we did come up here and enjoyed Gene Austin, a very fine gentleman. His wife was a lovely person. And he thought, I ought to see Bill Dwyer, general surgeon who trained at Mayo Clinic. And so I came out and talked to Bill and came up a couple of times to help him in surgery as assistant and see what happened at the hospital here and so forth and so on. And people were nice. He offered me a good situation where we could become full partners in a period of time and not an employee. And that suited what I wanted to do and so forth and so on. Now, when we got started at the hospital, you go from a training situation to a community hospital, and things needed to be changed somewhat. And you're thinking, these were days when Lynn Mansell would use drop ether to put patients to sleep and so forth and so on, which is fine. It worked out very good. I remember when I had drop ether, when I had a surgery procedure done, and I felt like people were pulling me apart while I'm asleep and so forth and so on. It all worked out fine. And but you knew things had to change. And Gene Austin had said, this is going to be an area of growth. People are going to be coming in. The community was expanding, a wonderful community. You had churches here, friendly people here. And I remembered Gene Cook was a good person. And in 63, there were very few rental properties here in Medina whatsoever. But Gene found a place, and we had a good time over on Parkview Avenue where several other people were in our age. A couple other doctors lived in that block. And so we had a good time. But looking at the hospital, we really needed to move forward in the situation. And I think, in my opinion, we had some people on the board that maybe didn't want to move too fast. I don't know what you guys thought about it at the time. But then I think we tried to get something going, and Bill and I, and Amos Mears came to town. Then Robertson and Roy Miller came to town and kind of got the ball rolling, got some new members in the board of trustees, and things got to move. And now you look at the hospital we have now. I mean, it's fantastic. When you look at that lamp here, you didn't have the fancy equipment that you have today. And it's amazing to me, the changes between 1963 and now. It's just fantastic, the changes that have taken place.
So we have talked a little bit about the changes. And so what major changes have you seen in your specialty?
Oh, okay. I would say the biggest change that I see today is laparoscopic surgery. I had gone to the American College of Surgery convention, I think in Atlanta, Georgia, or someplace, and they showed a movie of a videotape of doing gallbladder surgery where you take the gallbladder out just through an instrument through your belly button and a couple other small incisions, done in a short period of time, safely, and under general anesthesia, obviously. But I think that was the biggest thing. Now, that was in 1989. We went away. We were in a group of three at that time. We went away for individual training to learn how to do this procedure. So we went down to, I think it was Cincinnati Hospital down there, the training hospital, learned how to do this laparoscopic surgery. So then there's an old saying, I think Ochsner from the clinic down in New Orleans says that something about don't be the last to give up an old procedure, nor the first to start a new one. Well, when you saw the videotape and how amazing it was to see that being done, so after learning the training, we wanted to start out with good, healthy patients. We wanted the procedure to work out nicely and everything. So now we did some on healthy patients, and you'd advance to sicker and sicker patients. And the point being now, for example, I came in the hospital at 7 o'clock one morning, had my gallbladder taken out at 8 o'clock, and I was home at 12 noon. Before, we'd admit the patient the night before. They would be having surgery, and then they'd stay for a week afterwards. Now, it's much better to get patients back doing what they were doing ahead of surgery, after surgery, lesser expense, lesser pain, and much safer. Now, today you see people, which I wasn't trained for, but now the group that we originated, they're doing colon resections, taking out a part of colon and hooking it up under the laparoscope, and many other procedures that we never even thought about. So that, to me, in general surgery is one of the really important things that are helping patients. It's safer, cheaper, and more efficient all the way along.
So, and then what are some of your thoughts about major changes in medicine in general?
We were talking about this. Somebody suggested, what were we doing back in 63 we're not doing today? And I spent a long time thinking about it, and I'm thinking, I don't know. But one of the things that came to mind are house calls. Now, even in general surgery, I would make house calls. Not often. I mean, how am I going to do surgery in patients' home? Let's face it, those days are long, long gone. But I think that's one of the things that I look at. And I don't know whether they make house calls anymore or not. It's a whole new ball game. I would say most of them do not. That's one of the big things.
Do you have any really poignant memories of an issue, a patient, something you've done in your practice?
Oh my, that's a tough one. I think of some of the funny ones that happened. I remember being called down to the emergency room. They said, Doc Farnham, you got to get down to the emergency room right away. We got a guy here. Okay, I go down there, and the guy says, I just shot something. I said, oh. So he led me out to his car, and he raises the trunk lid of his car, and there's his favorite dog, hunting dog. He had shot the dog accidentally. And I thought, heck, God, I'm not a veterinarian, but I got my stethoscope out, listened to the dog and everything. I said, man, I'm sorry. This dog is gone. So there's some of the things that happen. The serious things that happen and you wonder about is I remember a child being in a motor car accident. We didn't have any blood at the hospital at the time. And this boy was pretty seriously injured with an intra-abdominal injury. So didn't want to do it at the hospital here without blood being available. And we shipped him right away to Akron Children's. And he looked up at me and he said, "Am I going to die?" I thought, oh my God. He did. That hurt. It always hurts bad. Go ahead.
All right. Well, thank you so much for sharing that. We appreciate that. So, what would be your best advice to physicians coming into practice today?
What bothers me so much about seeing these, they're going to be employees. The private practice is basically gone here in Medina. I was not cut out to be an employee, and it's a whole new ball game. But by the same token, I'm a graduate of Mount Union over in Alliance, Ohio, which is a different story. But when you go over and talk to the students that are entering pre-med, and sometimes we are asked to join a group like this to talk to the pre-med students, and I say, man, I started out here and look where we are today. You're starting out here. Look where you're going to be in 10 years. Don't think of what you're seeing today. Think of what you've got 10 years, 20 years down the road. When you see the progress that we've made over the years, it's going to be amazing what the future is going to hold. But you've got to learn, you've got to stay current. We had to go back to learn training in ultrasound, localization for breast surgery, of needle aspirations, all sorts of chemotherapy situations, and so forth and so on. You're going to have to do the same thing. The training you're getting today isn't going to work perhaps 10, 15 years down the road. You've got to keep up. You've got to keep on top of things, and no changes are going to occur, and you're going to have to adapt to them. Otherwise, you're going to be left behind.
So, since you've mentioned changes, so what would you see as the future of medicine in both medicine in general and in Medina County?
Well, I think we've done a pretty good job, and it's continuing. I think there's very excellent care, but by the same token, there are some limitations to what can be done here. We don't do brain surgery, we don't do heart surgery, and some of those other things which have to go to the main centers and so forth. But I think the group here has kept up to pace pretty doggone well and provide a very good level of surgery here at Medina Hospital.
Well, that's great to hear. So, in the were you, excuse me. So, what final thoughts might you have that you'd like to share with the group? Something that would benefit either future doctors or just the general public in terms of other thoughts that you might have?
Well, I think that the public here can have confidence in the physicians. What I don't like is the politicization of medicine any more than I hate the politicization of so many things. I think of how they lied to us about the government, lied to us about the COVID situation and a few other things. Uh, but in general, I think that we can look forward to further progress. I think back to when we used to remove stomachs for ulcers, bleeding ulcers, and things like that. Now, instead of taking a stomach out or doing surgery on a stomach, you take a pill a couple times a day. This is going to happen again in the future. Take a pill to cure a cancer, do something else. This is going to be in the future coming down the line. And we got to be prepared for it, accept it. Like I say, don't be the first to start a brand new procedure until it's a little bit proven, but don't be the last to drop an old item along the way.
Any other thoughts?
Oh, can't think of any right now.
Thank you so much for your time, Dr. Farnham.
Yeah. Well, something else I think ought to be mentioned. I don't know what you guys talked about, but I think one of the things that we ought to really give some thought to, it's the fact that Ed Hall came to the hospital at a great time. And remember, we used to have to go from 750 East Washington, the office building, run down to when we had to cover the emergency room, run down to the hospital, and we said, why don't we build a office center next to the hospital so you don't have to be running back and forth to the emergency room to cover the emergency room. Now today, I don't think, well, they have particular people that run the emergency room now, whereas we had to cover it in my day, for Pete's sakes. So that's one of the big things. I think Ed Hall should deserve some kudos for what he did, bringing a fresh air to the administration of this hospital.
Well said.
Anything else? I got a lot of things marked down here, and I think back to the old days. Remember when Dick Gross came he came about the same time, about 63, 64. And I'd have to call him into the emergency room when we had an automobile accident to read the x-rays, because he was the expert at it, not I. And he'd come over dressed like I am in the middle of winter. And I said, Dick, what the heck is wrong with you? It's cold here. He said, Ed, have you ever lived in Fargo, North Dakota? I said, no, now I understand it and everything. But I thought the guy was nuts. And then it was funny because Bob Winter lived down in Westfield Center. And I'd have to call him sometimes at 3 o'clock in the morning, come up and read x-rays. Well, he'd get in his sports car. He got picked up more than once by the patrol because he was speeding to get up to read and so forth and so on. And those are some funny times that we had going on. Shooting in the emergency room. I mean, people coming in bashed up at automobile accidents. But those are some good days. Talking about, remember when Carson would get in with your partner,
Miller, yeah.
Right,
Miller.
Roy, about parking in the emergency room and things like that. Oh gosh. Oh, thinking back to some of those things. I wrote a whole bunch of things down.
Go ahead and talk about it.
Well, I think one of the things, you knew people at the hospital. You knew the guy that cleaned the floors, the maintenance people, the x-ray people, the x-ray technicians, lab technicians. You saw them. Today, I don't know whether this is still going on, but we have what I call circuit rider doctors. How many of today's doctors live in town? I don't know. But living in town is a different thing than living in Cleveland and operating on somebody. You operate on somebody, you see them at church. If you're doing the front yard, patient would stop by, you'd talk to them, how are things going? Whether this personal, it would be like more of a family. You knew what nurse you were operating with, who the technicians were, who you could trust, who you couldn't trust. Today, the doctors tell me they don't know what nurse they're having, when, and where. Now, this is from them. I don't really know exactly what's happening, but I want to know what nurse I'm working with. And now the other thing would be is the malpractice situation. There had been a period of time where we really had a malpractice situation here in town. Everybody wanted to. I had one lawyer come up to me and say, can you find a case that I can do for malpractice? And I thought, hell no, I'm not going to do that. I mean, everybody's trying to do the best they can, and things don't always go all right. Stuff happens, and patients are sometimes in real bad shape and may not make it, so forth and so on. Today, that's a different ball game, but it was more like a family situation. I remember calling Lynn Mast up. I said, Lynn, you better come up in the emergency room. I had examined this guy. He had a little cut in the retina. It would be the retina was hanging out from a small cut in the eye. I said, I can't do that. Get your butt in here and get it taken care of. Or if things like that happen. And Today, I don't know. We don't have some of these guys. They're circuit riders. They don't live in town. Not that they're bad doctors or anything. Like my cardiologist was living in Worcester. Well, that's fine, but who do I go to? And they said, well, you better go to the emergency room and then they'll find you somebody. Well, I kind of like to have a cardiologist in town. Things are a little different. And we're going to have a meeting next week where a lot of retirees from the hospital, whether they're x-ray techs, lab techs, or doctors, nurses, everything, meet at a church in Valley City. Or it's going to be Brunswick this year.
Yeah.
I bet you when us guys are all gone, I doubt this is going to happen again. It's a new thing. And it's corporate medicine, as I call it. And I'm not so sure that's the way to go. I think the personal taking care of somebody, when you trust your family doctor, when you trust your surgeon or your OB man. I look back, there used to be 350 babies delivered in Medina Hospital per year. There are no deliveries in Medina County, a county of 165, maybe 170,000 people. Nobody. You have to go somewhere else. Well, what if you're in distress? Well, they can take care of you in the emergency room. That's not the way to do it, guys. I don't like that part of it. And, well, Denny, didn't you deliver babies?
Oh, sure.
I mean,
Lots of
yeah.
them. They suddenly told me my insurance was going to go up to 100,000.
Yeah.
I continue delivering babies.
Yeah.
I said, I'm only getting $900. I can't afford that.
I mean, it is a business. You gotta pay your dues and you gotta feed your family, You still gotta make a living.
So we've heard that a lot.
Mhm.
So when you talk to younger doctors, maybe not the brand new ones, but they've been in practice 5 years, 10 years. What is their sense of how satisfied they are, or do they have that same sense of loss in terms of getting
I don't
family
think so.
oriented? No.
But I had some work done not too long ago, and a female surgeon. I mean, not that I care, male, female. My partner was Chinese, good guy. He operated on me. I don't care. I care about competency. Are you trained well? Are you ethical? Are you doing a good job? Or at least trying to do an excellent job? The person that I had, they're accepting it because they didn't start out here. They're starting here. And it's a different ball game when you enter into the practice today, or the corporate practice, as I call it. You're accepting of that. And it's a different ball game from 1963 to 2000. And I think the kids today accept it more than I would have and did, period. Yeah.
Do you think they missed something
Yeah, I do. I do. Yeah. Yeah. And like I say, how many of them are going to make a house call? I don't know. You go into their home, you see their family and stuff like that, and you know what's going on. You see them in church, you see them out walking around different places. It's different. And if you're not brought up that way, you can't miss something you haven't had. Any other question?
Do you have any other things on your sheet you want
Oh,
to share?
let me see. Oh, I don't know. I ranted and raved. Let's see. Oh, one thing I got a kick out of when I first started here, and they call in. Oh, that's another thing that I can't get over. You can't call into the doctor's office anymore. You got to call into some center and God knows where, and they'll tell you when. Well, my name was in the phone book when they had phone books. You could stop by my house. My phone number was listed there. My address was listed there. it isn't that way
Mm.
today. But I still remember back in '63, the phone company, you had a 3-limit cutoff. And you'd be talking to a patient and you'd be talking as fast as you can, then the cutoff would happen. And so you'd run to the patient in the office and take care of them. And it was terrible. But then you had to pull strings to get a private phone into your home in case you had to run into the emergency room. And thank God I knew somebody that and I was able to get a private phone. Otherwise, how can you practice and cover the emergency room and not have a private phone in your house? Those things like that are just, when you look back on it, are kind of funny in a way. People can't believe you had a 3-minute cutoff. I remember even when we had hall beds before the new hospital was built, we had beds in the hall with screens around them, trying to take care of them and stuff like that. And you look at today, you go into an operating room, it's just utterly amazing, the equipment they have, the videotaping, everything. It just, you got to keep up. And I think Medina Hospital has done a pretty good job for a general community hospital. Really, I had to. All the new equipment that they have, you think back when you really had to examine a patient and take a history and physical. Now you got PET scans, CAT scans, ultrasound, this, that, and everything else, which has tremendously changed the field of medicine and the diagnosis of people and everything. I think just the thing to think about is that we're going to be making progress. When you look at things here on the table, for example, how far we've come, and when we used to have to open somebody up to take their gallbladder out or appendix out or even doing a hernia repair on them, today you have it done the morning you're home that afternoon. You think of this, how far we've come, but then think, what's it going to be 10 years down the road, 20 years down the road? Going to be amazing, I think. And I'm not going to be around to see it. Like I say, I don't buy any long-term warranties anymore at my age. But yeah, I can't think of anything else. I'm out. Any other questions at all?
No,
It's fantastic.
it's
It's been a ride.
Thank you so much.
I think back and I think we made some good choices coming to Medina.
Mhm.
Yep.
We're glad you did.
Oh yeah.
I think everybody's including Dr.
Have you stopped buying green bananas yet?
Don't do that either. Oh God. Yeah.
Well, I'm not sure how old you are. I know how old, I understand. I just look at this and say, I hope to God that I'm in your shape when
No
I'm
kidding.
that old. I mean, it's amazing. So I don't know what you ate for breakfast or whatever.
Raisin bran.
I need you to write down the secrets to life before you leave.
Oh God. I can't believe I've lived this long. You know, my wife and I are both the longest living in our families, period. And it's interesting because I went up to, there's a a school up in the Conneaut area, Farnham School. And there's a cemetery right beside it. And some of those names are in the early 1700s. So I've made sure my grandchildren go up there. The school has just been torn down, my understanding is. And there's a park by the name of Farnham. So I know the forebears came there. My grandfather came from someplace, I don't know where, but they lived up in that area, and he became a railroader for the Pennsylvania Railroader, a conductor, which was a good job back in his day. And he moved to Alliance, Ohio, where I grew up. And that was because the confluence of railroads there to form an alliance of railroads, and hence the name. And I went to Mount Union College there at the time. Now it's called University. when I asked the president of the university why the name change, he says, keep up with the times. It's the same school, but you know, it was great. I think it's been a heck of a ride. And 93 years of age, I don't know. God's let me live, but still wonder why. But yep,
Thank you so much for coming.
Oh, yeah.
my
Sure.
privilege.
Yes.
My privilege.
And I'm really impressed with the common theme about
Yeah.
patient care.
Yeah, isn't that
Because,
interesting?
yeah, when
Is that right?
Everybody.
when you call and you get some person that's like an answering service,
Yeah.
So and with the technology in my charge, I mean, there is a lot of
No,
advantage. but
yeah,
you
that's
still-
wonderful. That my chart.
Or the ones that said, "Oh, you can schedule online, except for this doctor."
Yeah.
You know?
Yeah, and then you got to check to see whether they're in that
Oh, in network or out of
network or out of the network and stuff. I mean, no, you take care of people.
Yeah.
God.
Yeah.
Yeah. Yeah.
Well, I think you're finding with probably because of the acquisitions of Cleveland Clinic just keep expanding. You could have, which I found with some of my medical problems. So you have one doctor, it's a Cleveland Clinic doctor, but he's out of network because he's in this other group or something. It just so you have to doctor shop, and then I would prefer maybe to pay a little extra to get one of you guys to work on me, you know.
Well,
It's interesting. We have senior coffee.
Yeah.
And we missed you this morning too.
Well, I tell you, with my knee problem, I was in Columbus sitting in a meeting all day long yesterday, and with my knee problems that I'm having right now, in the last week, I probably haven't slept more than 2 or 3 hours a night.
Ooh.
So,
Ooh.
So you're excused.
yeah. Well, and then the other side of me says, you know what? If I get out of bed, when I finally do get to sleep and go, I'm down there doing little simple things, and Doc Mass is almost running in his track. I thought, holy crap, I can't do that. I'll just sit here and watch it. But
So here was my Tuesday. How many steps do you get a day?
Well, you run 5 or 10 miles every morning, don't you?
This is Tuesday. I did 32,449 steps.
Oh, great.
you know, that just makes me tired.
14.6 miles.
Wow.
Wow.
Yeah, and I'm sure
That was a little longer than usual.
Yeah, but yeah, that's amazing.
Well, thanks.
Yeah,
And it wasn't so bad after all.
Great job.
Oh, cute little. I mean, I'll tell you a little story about modern medicine today. I had a real bad infection in my finger here, and I thought, well, I'll go see somebody about it and so forth and so on. So they said, well, no, you can't do that. I went down to the hospital and they said, well, you got to go over to this person here. Well, it was a nice woman there and everything. And I said, I got a severe infection in my finger here. She said, well, finger, that's a hand surgeon. And I said, yeah, well, that's fine. So she says, hand surgeon. Yeah, he can see you in 3 months. I said, but I got a bad infection that hurts and I don't want it to spread somewhere else. She said, well, you can go to the emergency room. Okay, so I walked over to the emergency room, and just at that time, 2 ER squads came in. I said, I'm not going to sit here and have hold up a sore finger, and these people are in dire distress. So I went home, and somehow I got to a guy that was on call, and he says, well, I can't see you now, but hold your finger up. Now turn your phone on. And I said, well, what do you mean? He said, your camera and your phone. So I hold it up. He says, looks at it on the camera and says, I'll see you tomorrow morning at 9 o'clock. So I'm like, okay, fine. I get in there. He says, yeah, it needs a little surgery. He does it under local, which is fine, and so forth and so on. So then the next couple of days, I go up to Brunswick to have other doctor. look at my finger and so forth and so on. But this is modern medicine today. But to hold your finger up in front of the camera, what the heck? But I got in. I got in.
Yeah, I seriously broke my shoulder big time.
Oh,
I fell,
that hurts.
and so I ended up, I was like 100 yards from the new urgent care on Court Street. So I thought, I'll just go down there. And there's a nice old lady in this car picked me up. Saw me laying there in the parking lot.
Ooh.
Trying to figure out how, because this is just not working. So they took me down, dropped me off, and the big doc looked at me and said, "You need to go to the ER." So I went down to Medina ER, and they took X-rays and everything, and so then they decided that you're going to need surgery, and as an emergency surgery, it'll probably be 3 or 4 weeks before we can schedule this. And I said, oh, and I said, well, if it wasn't, well, we're doing shoulder replacements. We're scheduling in March this was October.
Yes.
And so I went up and went through this whole process. And of course, each test was at a different Cleveland clinic. So I think I've been to every regional campus. And so I had everything scheduled, and the doctor was the surgeon who was supposed to do it. And he said, "This will work out. We can do it in another 4 weeks." And my wife's going to have a baby, but she's not due for 6 or 8 weeks, so this will work out. The next day, the nurse called and said, "Doc's wife just went into labor. He's not going to be able to do it." Starting out.
Oh, no.
And then, well, originally, the first, you need a trauma surgeon because it's so bad. Okay. Like, you probably did everything. If I came in with mine, and of course, even the fact that you may not have had a reverse shoulder replacement type thing, where they go in, and whoever sewed me up, I'd like to meet him, because my God, I hardly have a scar there at all. Versus, you see some of these.
Yeah.
Well, the other thing that you see changed, we had a group of 4 guys. Now we have a group of 2 women, 2 guys, my old group. How women are now the majority of students going to med school rather than men.
Where we heard this story.
Yeah.
We were just talking about that.
Yeah.
How many women were in your medical?
4.
4.
And a lot of, maybe 6 at the most.
Yeah.
And some of the professors, some of us guys really felt sorry for some of the girls there, because they were nice people.
Yeah.
But some of the professors really didn't want them in there.
Yeah.
They really didn't want them, and they were kind of mean to them sometimes. And we felt sorry about it. And that's the way it goes. I mean, I remember one day I had the flu really bad and missed 3 days of school in med school. And we had exams every day. You had a test every day. So that means 3 days of F's. So I went to the professor and said, "Is there anything I can do to make this up, or what can I do?" And he said, "Mr. Farnham, I don't recall inviting you to go to the school here." I said, "Thank you, sir." Walked out, and I said, "God, I'm not going to let this get me down, by God." I couldn't believe it. When you at the University of Mount Union, you could go to the professor's house and talk to him. They didn't really, my opinion, they really didn't care whether you passed or not to some extent in med school. You would think, it's a different attitude. I hope today it's different. I surely do.
Yeah, I don't think it's probably different. And it's, I taught at Akron U in the criminal justice for about 4 years. And all that they were concerned about, I taught introduction to criminal justice. And my first day I walked into class, and I was in a lecture hall with there was 120 seats, and I had 155 students on my, what they call first day roster. So I went to the dean. I said, "Where am I supposed to sit? Oh, they'll drop out." He said, "All you want to do is try to keep them on to the 14-day list, because that's when all the tuition is due."
Yeah.
And it's probably about the same thing. We just want to keep you happy.
Well, we had a few guys in school that really didn't want to be there, but mom and dad wanted them to be a doctor. And they were the first to flunk out. You'd be taking an exam that'd last an hour and a half, and you're sweating down, and they're done in 15 minutes. They're out. And you felt sorry for them. And I remember one guy, no, I can't tell that story. No, I better not.
Remember your oral exams and surgery? You had some written, but it was mostly oral exam.
Okay.
And I, for your surgery department down at Ohio State, and I had everything memorized about appendicitis, diagnosis, treatment, everything. But then he says, well, tell me, Mr. Roberts. And he says, if you're standing on the equator at noon, how do you calculate how far it is to the sun? I said, well, for sure. Ohio. What does Ohio mean? Is that a Japanese word? Or is that, I said, I don't know.
Jeez, wow.
I had no,
Did you have?
I'm going to fail surgery because I don't know what Ohio means.
Oh God! Did you have Zollinger?
Yes.
Oh my God!
Oh, the story, yeah.
Oh, the stories about that guy. We had a guy there, and it was what, 7th floor, as I remember, something like that. And the Z cut a ureter.
Right. He says, how long will it take for everybody to know that Dr. Zollinger just cut the ureter?
And he had what's his name stand at the end of the hall, and he says, "I want to hear you at the end of the hall shouting out, the Z cut a ureter." Oh God, the stories they told about that guy. Then he dies of a disease that he was one of the head guys investigating the disease, for crying out loud. And I think amazing. Zollinger-Ellison syndrome. Yep.
I remember when they posted whose service you were going to be on.
Yep.
When surgery, and I was on the Z service.
I had 2 tours of duty of him.
Oh, yeah.
But I got along real well with him. Did you get invited out to his house?
No, I got invited to go up. This is the first few days he came to lecture the new students. And, we had the whole group, because we have a quarter off. Yeah. And he had the whole group there. And he pointed at me. I had to go up to the stage. He says, put a drawing up there. I want to know where the appendix is. Well, I'm thinking back, well, it's 90% of the time it's down here. So I mark it down here. He said, no, go sit down over there. It can be anywhere. Oh, yeah. Same trick with you guys, I suppose.
Yeah.
Oh, yeah, the CPC, the clinical pathological.
Oh,
He had 2 fish bowls, the junior and senior students. And he'd pull a name out and look at it, and then he'd call them down. He said, and the one, he said, where is so-and-so? He says, well, it was New Sigma knew. He was kind of hungover from the party last night, so he didn't get up. Oh, get him on the phone. Get him on the phone right now. And he picks him up. He says, tell me, what is the arterial supply and venous drainage of the pancreas?
Yeah.
This guy is hungover talking to Zollinger.
Do you remember the story of the Z was operating on the stomach and so forth and so on? And they had the patient all opened up. Chief resident was there, the junior resident was there, and the student was there. So the Z opens it up. The resident will usually open the patient up, and he just came in and did the main part.
Okay.
He said he put his finger in the stomach, felt around, and the guy was supposed to have a bad ulcer in the duodenum. And so Z checked it out and said to the chief resident, yeah, you check it out. Yeah, Dr. Zollinger, I agree with you. There's a big ulcer there and everything. And got down the junior resident, and then the student says, well, I don't feel anything. Z says, you're goddamn right. There's no ulcer there. Made the chief resident stand in one corner and the junior resident in the other corner, and he and the student finished the operation. Oh, God.
And he threw the residents out. And so it's just my brother's a junior student, and him to do the surgery. And he grabs the asepto syringe and just sprayed my brother off and down here. There, he says, now everybody was scared Dr. Donald just scared the piss out of you.
Yeah. Or one guy leaned over, one of the students leaned over, and his glasses fell in the wound, and they stuck an IV pole up his back and taped his head to the IV pole. Oh, God. but you know what? You remember all those
Oh,
things.
yeah.
I mean, the guy was an instructor, and oh
He was
God,
at the Road Society too. The
Oh,
American
he-
Road Society. He was in charge of that too.
we had one guy in my class. This made me wonder, what am I doing in med school? We had a guy in my class, Paul Ebert, All-American in basketball at Ohio State University, All-American in baseball at Ohio State University. A nice-looking guy, about 6'3", tall. The guy was good. He ended up being professor of surgery at Johns Hopkins University. And then he became president of the American College of Surgeons. The guy had it all. I mean, he's since passed on, but I mean, good looking guy, athletic. And I'm thinking, here's little old me. What the heck am I doing? You know, but
So you guys didn't get invited out to his house?
no, sir. Nope.
That's interesting. I thought, well, I was on his service.
Yep.
Nancy and I, along with the rest of the people that were on the service, got invited to his house. He had his roses out there in the house and
Yeah.
everything. And we had dinner at his place.
He must have mellowed. Well, I remember one time on surgery service, the resident said, now, I want you to go in there and do a history and physical. And under chief complaint, I want you to write it down exactly the way the patient says it. Yes, sir. Fine. So you go in and did it. The guy was a young fella, and he says, I can't repeat. Swear word, swear word, swear word. Well, I'm thinking, now do I write that down? Well, the resident says you got to write it down. So we got together then with it, and you had to get up and stand there and say, well, what was the chief complaint? And I read it off and said it just like, oh, the roof was going to come down. Make up your mind, you know. And then at 3 o'clock in the morning, if the resident got hungry, you had to go down and get coffee and donuts for them. They made you feel like you're a piece of cheese for the mouth sometimes. But, you know, you think back, those are just good times, really.
Yep.
We were privileged to have
We all
the,
got through it.
yeah, we were privileged to have the good training down there. I mean, I think of some kids that they realize that there are different med schools and so forth. And yeah, been a heck of a good ride.
Yep.
Well, thank you.
Life's been good.
Thank you, sir.
When do you head down?
Oh,
South.
We